comparative because tatandaan mo lang ano yung unique features ng bawat isa. So, in total, 60% ng anatomy ay manggagaling sa mga parang i-share ko sa inyo. So, I know anatomy will be a lot of boring for most, but let's make it fun. So, enjoy lang natin yung anatomy kasi, bakit? What is anatomy in VLE? Okay, ano nga ba yung anatomy? Bakit kailangan? Hindi natin siya binabasta-basta. Okay? So, it is the first subject in the exam. And alam mo yun, kapag maganda yung anatomy performance mo sa exam, sunod-sunod na yung performance mo sa ibang subject. Imagine mo kung anatomy pa lang minamali ka na ng exam, feeling mo mahirap na yung mga susunod na subject. Pero kung anatomy pa lang ay madali na para sa'yo, or maganda yung performance mo na feel mo na, ganito lang pala yung board exam, sunod-sunod na yan. Okay, nasa mindset yan. And second, it is one of the easiest subject. So, aminin man natin o sa hindi, anatomy parang sinasabi natin, mahirap yan. Pero pag kasi inisip natin mahirap yan, talagang mahirap yan. Pero kung inisip natin na madali siya, at iintindihan natin siya, mas madali nating ma-recall lahat ng mga terms na pwedeng itanong sa anatomy. Okay? And then, in the board exam, alam mo kung saan kinukuha yung question sa anatomy. Unlike with pharma, sasabihin sa pivot pero parang hindi naman, okay? Or kunwari, sa para or sa medicine, very broad, sabihin Merck, pero napakarami ng Merck. But in anatomy, hindi naman nagbabago yung femur, hindi nagbabago yung mga terminologies na ginagamit doon. So, alam mo agad na meron kang idea na pag inaral mo to, malaki yung chance na maitanong ito. Okay? So, yun yung mga pwede natin isipin na pang panimula for veterinary anatomy so that meron tayong magandang pundasyon. And take note, anatomy is 10% I think of your grade sa VLE. So isang tip ko pa ngayon bago ako magsimula ng klase ko ay kung nahirapan kayo sa anatomy ng isang question, huwag kayong mag-alala, hayaan nyo na lang 'yon. Kasi may mga questions kasi na parang super hirap, pero ang point naman niya ay same lang naman dun sa madaling item. So huwag kayong magpanic kung may mga hindi kayo masagot kasi malamang hindi rin nakasagot yung iba. So yun na lang isipin niyo para hindi maapektuhan yung pagsasagot niyo sa board exam. Okay? So these are the topics of the dog anatomy. So we'll discuss it by system kasi sa TOS ay naka-by system yung ating anatomy. So skeletal, muscular, up to the special senses. But today I'll be discussing, hopefully matapos ko until digestive. So ito yung coverage natin. The rest will be discussed tomorrow for the continuation of the gross anatomy. Medyo madami naman kasi itong part na to, yung bulk na to. Pero ito madali lang kasi mas madami or mas madaling tandaan yung mga or ma-recall yung mga terminologies, anatomical terms na ginagamit natin for that particular item. Okay? So let's begin with the skeletal system. By the way, if you have any question, you can open your mic and ask it, or pwede nyo kuhanin yung attention ko sa chat box so that we can briefly discuss kung ano man yung medyo confusing na terminologies. Okay? So skeletal system, we'll discuss first with the skull or the actual skeleton. Alamin na natin ano yung mga part na to, recall lang natin. And remember, the anatomy of the skull is divided into two. Okay? So we have the cranial part, which is the one that is enclosing the brain, or we call it cranium or brain case, and the facial part. Those are the structures that are supporting or protecting the organs for digestion and for the respiration, like the nose, the mouth, the tongue, etc. So ano yung mga parts na yan? Pwede kasing matanong. The following are part of the facial part of the skull except. Okay, so recall lang natin. For the cranial, we have the occipital, the frontal, parietal, temporal, ethmoid, sphenoid. So ito yon mga yan. Isa-isahin natin yan later. While the facial part is composed of the maxilla, ito face of the most of the face, incisive, the nasal, palatine, pterygoid, zygomatic, lacrimal. Wow, ang dami, di ba? So, at least sa anatomy, tandaan mo lang saan ba ito located. Okay na yon. Kasi may idea ka na paano mo siya iisa-isahin. So, yun yung goal natin. I-recall natin saan nakalagay yung mga structures or mga buto na yan sa skull. So, first is the occipital bone. Ang tandaan nyo dito ay ito siya. Siya yung back door ng skull. So, pinakalikod. Imagine nyo that the cranium is like a house. Meron siyang bubong, merong likod, merong wall, may floor. Okay, kasi nga in-enclose niya yung brain. So, the back door is the occipital bone. At ano yung mga structures na meron dito? We have the foramen magnum, the largest foramen in the skull. Ito yung parang boundary between the brain and the spinal cord. So, pag exit ng kunwari brain siya, tapos mag-exit yung from the medulla oblongata, mag-exit siya, that will be the spinal cord na, okay, from this foramen magnum. And then, lateral to the foramen magnum, we have this two bony prominences. We call it occipital condyle. So, tandaan nyo dyan ay siya yung reason kung bakit we cannot move our neck like 360 degrees. Kasi pinipigilan itong occipital condyle. Unlike with chicken, na isa lang yung occipital condyle nila, kaya nilang i-rotate yung head nila. Okay? Occipital condyle. And next, bony prominence is the jugular process. This is the pointed structure lateral to the occipital condyle. So, inaano lang natin ito, nire-recall natin yung mga part kasi pwedeng yung question, saan mo makikita si jugular process? Anong buto siya? Okay? So, it's in the occipital bone. Then, external occipital protuberance, ito yung, di ba, when you pet your dog, so yung pag hinahawakan yung ulo, dito sa ulo niya, and then may makakapa kayong bukol, that's the external occipital protuberance. Protuberance, ayan. Then, next is the roof, yung bubong naman, we have the frontal bone, ito. So, partly, isa siya sa bumubuo, it's the rostral bone of the roof, parang harap. So, this is the frontal bone, and then yung mga structures na dyan. So, we have the zygomatic process of the frontal bone. Ito yung patules. Take note that the skull of a dog is, they have an incomplete orbit, at isa sa nagpo-complete is the orbital ligament. So, yung triangle na to, this is the zygomatic process of the frontal bone. So, here's a dorsal view of the what do you call this, frontal of the skull, showing the frontal bone. Ito siya. Okay, frontal bone, bubong. And then, we have the parietal bone here. So, this is the caudal naman, caudal roof. So, this is frontal. Kanina, ito naman parietal. Nasa likuran niya. So, i-recall natin ano ba yung arrangement nila. Parietal bone, yan. And then we have the temporal bone. This forms the wall. Parang, ano tawag ito? Dingding siya ng skull. So, this is the temporal bone. And actually, the temporal bone has a lot of structures. Okay? So, first is this one, tympanic bulla. Tandaan nyo about this is, ito yung nagha-house ng middle ear. Okay? So, this houses the middle ear. At ano yung meron sa middle ear? So, you have the three bony, yung three ossicles. You have the malleus, the incus, and the stapes. So, dito sila naka-house sa tympanic bulla, which is a part of the temporal bone. By the way, if mabilis ako, please tell it to me para mabalance ko yung pacing ko. And lahat naman ng sinasabi ko ay nasa review notes na pre-provide ko. So pwede nyo sundan, you can download it, tapos pwede kayong mag-note doon sa para masundan ninyo. And then we have here the external acoustic meatus, this one, or the external acoustic meatus. So ito yung dugtungan ng external ear tsaka ng middle ear. So this is an opening, and this is being covered by the tympanic membrane in a living animal. The tympanic membrane is the eardrum. Okay, that's the eardrum, the tympanic membrane. Next, we have the zygomatic process of the temporal bone. This parang anong tawag dito? Uh, Pahaba na structure. And then they're forming the zygomatic arc together with the temporal process of the zygomatic bone. Ito, mamaya discuss ko mamaya. Yan. So also, we have this temporal fossa. And very, ano siya sa dog. Ayan, itong temporal fossa na yan. So, very distinct siya sa dog. And that is the reason why they have this temporalis. Kasi yung mga masticatory muscles ng dog, they're very powerful. Kasi sila yung, they need to be big. Kasi powerful yung kanilang, para powerful sila. Okay? So, temporal fossa for the attachment of the temporalis muscle. Now, ethmoid bone, I cannot show you the ethmoid bone in this section. So we can make a sagittal section of the skull. So hinati natin siya. And asan sa ethmoid bone dyan? This is by the way the cranial cavity. So dito cranium, dito nakalagay yung brain. So the ethmoid bone is here. Ito. So the ethmoid bone, siya naman yung front door. Okay, yung harap. Kung si occipital bone yung likod, ito naman ethmoid yung harap. Okay? This is unpaired. Lahat kasi ay paired except sa ethmoid, sa vomer, yan, may mga unpaired na bone. And then, punta tayo sa floor, we have the sphenoid bone. So, this is the sphenoid bone. And we call it sphenoid complex kasi meron tayong tsaka base-sphenoid. So, this is the pre-sphenoid, yung harap, the pre-sphenoid. And then, the base-sphenoid yung likod. Yan. So, this serves as the floor of the skull. And take note, the sphenoid bone, hindi ko nakaano dito, meron siyang tinatawag na depression. That is what we call the sella turcica. And the sella turcica, siya yung nag-embrace naman sa pituitary gland. So, natatanong yan, minsan, anong structure ni sphenoid bone yung nag-enclose kay pituitary gland? Or the other way around, ano yung structure na pinoprotect ni sella turcica? That's the pituitary gland. Okay. Kasi sa anatomy niya, di ba? Parang tongkil term ba yun? Parang nakalabas si pituitary gland sa mismong brain, tapos sinasapo siya ni sella turcica of the sphenoid bone. Now, those are the bones of the cranium. So, yun. So, mayroong bubong, may wall, may floor, may front door, tsaka back door. Now, punta naman tayo sa bones of the face. Okay, yung pinakamalaki, it's the maxilla. Okay, or we can call it maxillary bone. This is the bones of the face. So, ang structures na meron dito ay, may guhit. Okay? Huwag po kayo maguguhit Ayan. Ay, permanent na siya. Pakidelete na lang po kung kaya nyo i-delete. So, ang structures na makikita natin dyan is the infraorbital foramen. So, the infraorbital foramen is actually a big opening. Tinawag siyang infraorbital because it is below the orbit. Infraorbital, okay? So, sa ibang hayop, we have the foramen above the orbit. We call it the supraorbital foramen. However, that is missing in dog. Yun yung unique sa skull niya. Missing si dog. Missing si dog. Missing yung supraorbital foramen. So, meron na siyang infra. So, if you'll ask me, kailangan ko ba memorize yung mga foramen, etc. Pwede nyo siyang basahin so that you will have an idea kung anong mga structures na dumadaan ganyan. Pero, I won't recommend na i-memorize nyo siya lahat kasi parang it will take a lot of time. I myself, hindi ko memorize lahat ng foramen, especially kung ano yung dumadaan sa kanya. So, kinukuha ko lang yung keyword, kung ano ba yung pwedeng dumaan dito. So, basta alam ko yung location niya, I have an idea kung ano ba yung dumadaang structure sa kanya. Okay? So, yan. So, kung hindi matanong, 1 point lang yun, okay lang yun. So, most of the students sa naano ko, ang alam nila maxilla ito lang. Pero pati yung sangalangala, it's also part of the maxillary bone. So this is the ventral view of the skull, and this is still part of the maxilla. And they form actually the bones that supports the hard palate. So this is the incisive bone, this is the maxilla, and this is the palatine bone. Imagine napakalaki niya. Okay? So isa pang function ni maxillary ay they actually hold the bones of the upper dental arcade. Especially yung canine, tingnan nyo baka ang question dyan, anong buto yung nag-hold ng canine? So this is the maxillary bone. Mga premolars, and then we have the molars here. Next is the incisive bone. The incisive bone here, siya yung most rostral bone of the animal actually. So siya yung tandaan nyo, pinakaunang buto. Okay, so this is the incisive bone, pwedeng of the skull or of the entire animal. So ang function it holds the incisors, the upper incisors in place. Yan, so incisive bone. So aside from that, we have this palatine fissure. Most of the reviewees na namamali sila, akala nila, the palatine fissure is located in the palatine bone. But actually, it's in the incisive bone. Ito, palatine fissure, because this is still part of the palatine bone. Sorry, part of the incisive bone, sorry. Next, we have the palatine bone. Ito yung palatine bone natin. Parang paired din siya. At actually, parang ang role niya ay napagkakamalan kasi siya lang yung nag-form ng hard palate. But actually, it is just one of the 3 bones that forms the hard palate. Ulitin ko, the hard palate is composed of thank you very much for removing that. We have the incisive bone, we have the maxillary bone, and the palatine bone. So kung nahirapan kayo mag-memorize, actually ang tip ko dyan, ulit-ulitin nyo hanggang sa memorize nyo. And at the same time, pwede nyo isulat. Okay, I know that the board exam is multiple choice, but kung meron kayong libro or meron kayong notebook na sinusulat nyo lahat ng mga information na bago sa inyo, sinusulat nyo, paulit-ulit nyo yan. I don't want to use the word memorize kasi but hindi natin maiwasang i-memorize kasi especially anatomy is more about memorizing things. But if we try to learn it by heart, ako ang ginagawa kong pag-memorize sa mga ganyan ay ginagawa ko siya ng kwento para natatandaan kasi di ba mas mahilig tayo sa chismis. So mas matatandaan natin yon pagka ginawa natin siya ng ibang kwento. May backstory yung buto, parang gano'n. So bahala kayo paano nyo siya gagawa ng kwento para maalala pa. Mas witty, mas maganda. Ayan. So in the palatine bone, we have the two foramina. We have the major palatine foramen. Major kasi mas malaki siya. Then we have the minor palatine foramen. So they are located in the palatine bone. Next, the nasal bone. Ang description dyan ay siya yung dorsal roof ng nasal cavity. Yun lang. Paired siya. But hindi siya yung nag-dictate kung bakit matangos yung mga aso. Okay, it's not the nasal bone. So next zygomatic bone here. So the zygomatic bone is also known as the malar bone. At ito yung kaninang pinakita ko, we have the temporal process of the zygomatic bone, and together with the zygomatic process of the temporal bone, if you can still recall your gross anatomy, we called it as the zygomatic arc. Okay, parang nagkakamayan na yan. Kasi pwedeng possible question dyan, anong buto yung nagpo-form ng zygomatic arc? So sure ka na yung isa ay zygomatic bone. The other one is what do you call this? The other one is the temporal bone. Next, lacrimal bone. Saan ba siya? Yan, maliit lang si lacrimal bone at siya lang yung parang nag-house ng lacrimal apparatus. So yan, meron siyang lacrimal foramen for the tear canal. So ito ang kanyang cranial view. So here, maliit lang si lacrimal bone. Basta alam mo nandito siya sa bandang orbital region. Pterygoid bone, maliit lang din siya. Ayan. So meron tayong isang structure called the pterygoid hamulus. Ayan. So basta pointed structure siya protruding from the pterygoid bone. So part siya ng facial part of the bone. Then we have the vomer. This is the unpaired bone of the facial part of the skull. So nasa loob siya at parang isa siya sa tumutulong sa nasal septum para ma-divide yung nasal cavity into two equal halves. Okay? So vomer, unpaired. Then let's next move forward to another bone, the mandible. Technically, we can say it's part of the skull. Kasi pangit naman yung pag walang mandible, di ba? So let's review yung mga parts ng mandible. So it is being, actually, isang ganyan ay mandible. So you have two mandible. Paired mandible siya. Okay? So they are being joined by this joint. Symphysis ang tawag natin doon. Pag narinig nyo or nabasa nyo yung term na symphysis, it is a joint. Tapos, ang purpose niya ay pinagjo-join niya yung left and right halves ng katawan. So, mandibular symphysis, pelvic symphysis, okay, nasa midline siya makikita. So, mandibular symphysis. So, let's discuss the parts of the mandible. So, we have here the body. Oh, this is the body of the mandible. This is the, ano ba to? Horizontal. Okay, pahalang. This is the body. And the vertical one, that's what we call the ramus. Okay, this is the ramus. This is the body, okay, of the mandible. In the ramus, we have several processes. Yung mga by the way, pag sinabing process, these are bony projections. So, the tallest one, so like yung sinasabi sa mga students ko, pinakmatangkad coronoid kasi andun yung corona, di ba? Sa ulo naman nilalagay yung corona. That's the coronoid process, okay? Then the next one is the condyloid or the condylar process. This is also known as the articular process kasi ito yung nag-articulate kay temporal bone to form the jaw, yung parang temporomandibular joint or the TMJ. So yung kapag hinawakan niyo yung base ng ear nyo, tapos you open your mouth, open and close nga, yung parang depression na nararamdaman nyo doon, yung sugpungan na yon, that's the temporomandibular joint. Yan yung common na naglalakjaw. Okay. So, yung articulation na yan, it's between the condyloid process of the mandible and the temporal bone. Okay, may part ng temporal bone na nag-articulate sa kanya. Not the coronoid ha. Yung coronoid parang ano lang yan, arte lang yan. Okay? And then next, we have the angular process. This is somewhat, we can say not unique but present in dogs pero hindi na siya present sa the rest ng animals. Present din siya kay cat. Makikita mo kasi siya sa angle of the mandible. Pag sinabing angle of the mandible, it's the anong tawag natin doon? Yung parang dugtungan between the this is the between the ramus of the mandible, the vertical, and the body of the mandible, which is the horizontal one. So, ang tawag natin doon ay angle of the mandible, at yung process na makikita doon ay angular process. Okay? Angular process. So, in dogs, isang feature niya is meron siyang very deep masseteric fossa. So, remember what I told you about the temporal fossa? Same is true with the masseteric fossa. Makapal yung kanyang masseter. So, powerful kasi yung muscle na yan sa dogs. So, kailangan bigyan natin siya ng importance. If you compare that with other species, later sa kumpara, hindi ganon ka-distinct yung masseteric fossa. Okay? What else? In the mandible, we can see foramina. By the way, pag sinabing foramina, maraming foramen. Plural siya ng foramen. Yung nasa labas, we call it as mental foramina. Yung nasa loob naman, we call it as mandibular foramen. So this is the medial side, this is the mandibular foramen, and this is the mental foramen. Okay? Ano pa ba dyan? Okay, mamaya na yung iba ng structures dyan. Now we proceed with the hyoid apparatus. So the hyoid apparatus is actually um, tawag dito, meron tayong ano dito ayan, may animation. So, imagine, ito yung standing dog na makikita ninyo. And as you can see here, we have, this is the cranial side, or cranial end towards the head, and this is the caudal towards the tail, or the yeah, caudal. This is the in situ arrangement of the hyoid apparatus. So, the hyoid apparatus is basically composed of several bones. So, ito yung una. We have the stylohyoid here. This is the stylohyoid. Next is the epihyoid, the ceratohyoid, the basihyoid. The basihyoid is the only unpaired. The rest ay paired. Okay, basihyoid is the only unpaired. Then we have the thyrohyoid and sorry. Ayan. This is part of the larynx na. Ngayon, si Pasquini, if you're reading Pasquini, meron siyang chronological order na ginawa. Sick elephants can be treated. At very helpful siya. Kahit ako kasi nalilito sa order nito. Ngayon, tatandaan ko na lang to. Stylo muna bago epihyoid, bago ceratohyoid, basihyoid, and thyrohyoid. Okay? So, tandaan nyo, yan. Ang pwedeng matanong dyan ay, sino yung only unpaired? That's the basihyoid. So, yan ang ating arrangement. Or, what comes next after the after the stylohyoid? Pwedeng ganun yung uh, possible question na matanong dyan. By the way, I hope you were able to read the TOS for the vet med. Andun kasi yung mga questions na sa skeletal system, isa lang yung, tama ba? Isa o dalawa yung questions na kukunin doon for the gross. Tapos iba pa dyan yung another 15 which is more on the practical side na magagawa mo lang yon if alam mo yung basic part ng mga hayop. Next. Ano yung next? Now, let's proceed to other bones of the axis. So, these are the bones of the vertebral column or the vertebrae. So, ito yung mga backbone natin. Then we have the bones of yung parang sa thoracic cavity. That's the ribs. Ito, so yung ribs. Then we have the sternum. Yan, the sternum. So, tatlo. Now, let's proceed first with the vertebral column. At dapat kahit pa paano memorize mo to. Kasi kung matanong sa'yo to, at least malamang alam to ng lahat. Okay? So, hindi kayong iiyak dun sa, ala, hindi ko nasagot yung vertebral column. So, vertebral formula, parang ganon. So, ito yung order. Cervical, thoracic, lumbar, sacral, tsaka caudal. We usually use the word caudal kasi kapag coccygeal, that's for the human anatomy. So, caudal lang gagamitin natin kasi caudal means tail. So in the dog, this is the vertebral formula. C7 meaning 7 yung cervical vertebra. T13, we have 13 thoracic vertebra. L7, S3, kahit na isa lang yung sacrum. So tatlo pa din siya na fused na sacral vertebrae. And then the caudal vertebrae, these are nagva-varied ito depending dun sa number or sa breed ng aso. Okay, so iba-iba. So very to kahit ninyo i-memorize tong caudal na to. But ito, very distinct to per animal. So, C7, T13, L7, S3. Madaling i-memorize sa dog. Vertebrae, alamin lang natin yung basic parts ng vertebrae. So, this is a cervical vertebra. So, meron tayong vertebral body. And the vertebral body, siya yung bulk nung, oh, sorry, bulk nung pinaka-structure ng vertebrae. Tapos meron tayong arc. Yan, so arc. Ngayon, tong vertebral arc, they are composed of the following. So we have the lamina, that's the roof. And then we have the pedicle, that's the wall, okay, of the vertebral arc. Now, ang mga question na pwede dyan ay, ano yung dorsal process ng vertebrae? That's the spinous process. So, yung parang sungay, di ba? Spinous process. Then, meron siyang wings, di ba? That's the transverse processes. Okay, so spinous process, transverse processes, yung lateral processes of the vertebrae. And then, meron siyang tinatawag na mga articular processes. So, dalawang cranial, tsaka dalawang caudal. So, in total, we have a total of, parang 7 processes. So, isang spinous process, dalawang transverse, that's a total of 3 processes. And then, 4 articular process. So, meron tayong 7 processes. What are the other parts?
We have the vertebral foramen. So the opening between the vertebral body and the vertebral arc is what we call the vertebral foramen. So dito dumadaan si spinal cord at kapag si vertebra ay pinagdugtong-dugtong mo, this vertebral foramina will form the vertebral canal. Okay, so sila yung nagfo-form ng vertebral canal. Individually, it's vertebral foramen. And then, we have transverse foramen, kasi makikita siya sa transverse process. Okay, at least hindi na pinahirapan yung pangalan, di ba? So, we have the Nomina Anatomica Veterinaria, yung NAV. I don't know if that was discussed by your anatomy instructor during your college days. But, sa klase ko noon, pinaano ko ano yung mga kwan ng NAV, parang policy niya, ganyan. At isa sa policy niya, wag daw dapat nakakalito yung mga ang tawag dito, yung mga terminology, wag pa ulit-ulit. So, kunwari, nakita mo yung foramen sa transverse process, dapat transverse foramen na yung pangalan nun. O kaya, femoral artery, dapat yung vein niya, femoral vein. Okay, so yun yung mga rules nila. Ayaw din nila nung eponym, but hindi pa rin siya nawala actually. Marami pa din tayong eponym. Eponym ay yung parang pangalan ng structures named after someone. Like for example, the loop of Henle. Yan. So, foramen of Magendie. Pero hindi pa rin siya na meron pa din yan. So, tandaan nyo yung Board of Examiner natin, they maybe use the old book. So, most likely, ang alam nila yung mga eponym. Yan. Now, specifically, let's review yung mga tawag dito, cervical vertebrae na meron. So, the first cervical vertebra is the atlas. Okay? So, this is the atlas and siya yung unang-una, siya rin yung pasaway, okay? Kasi wala siyang spinous process, okay? So tinawag siyang atlas because it is the bone that holds the globe. Pag sinabing globe, ito yung skull, okay? So siya daw yung nagho-hold ng ganyan ang imagination ng mga anatomist before, di ba? So dahil ganyan ang role mo, atlas ang pangalan mo, okay? So ngayon, may body of Atlas, but in some textbooks, body is not present in Atlas. So, sana wag na lang siya matanong kasi ako ay nalilito din dito. In some books, sabi may body, in some books, wala. Pero ito ay modern na from Colorado State. Sabi niya, may body of the Atlas. Okay, so we have the body of the Atlas. Then we have the wing of the Atlas. The wing is the modified transverse processes. So, these are the transverse processes. Wing of the Atlas. And then, we have the transverse foramen. So, kasi makita mo siya sa transverse processes. And then, lateral vertebral foramen, mga present siya. And then, what is unique in dog is that they have the alar notch. In other animals, this is a foramen, and we call it as alar foramen. But in the case of dog, this is classified as alar notch. Okay, alar notch naman ang tawag natin sa kanya. Next is axis or the C2. Meron siyang ibang pangalan. Sabi lang, bawal. Pero sige, para lang may idea kayo. It is also known as epistropheus. Okay. Epistropheus or the axis. Tapos, what is striking about the anatomy of the axis is that meron siya nung tinatawag nating dens or the odontoid process. And the description of this is that sa dogs, tooth-like. Mukha siyang ipin. Yan. So, tooth-like yung dens ng dog. And meron siyang take a look at the spinous process. Ano siya, wide. Normally, the spinous process na alam natin sa mga vertebral, especially the thoracic one, matatangkad siya tapos maninipis. But in the case of the axis, pasaway din siya, atypical siya. Like the axis, they are also atypical. Wide yung kanyang spinous process, as you can see here. So that's the typical appearance of the axis spinous process. Now let's proceed with the next, the thoracic vertebra. So meron siyang spinous process na matangkad tapos narrow. So this is the spinous process of the thoracic vertebra. Pero yeah, we have the body. Pero kung gaano ka-proud yung kanyang spinous process, gano'n naman nahihiya yung kanyang transverse process. This is the transverse process of the thoracic vertebra. And what you need to remember about the thoracic vertebra is the number of thoracic vertebra or vertebrae corresponds to the number of the rib pairs, okay? So kasi sila yung vertebra na naka-attach yung rib. Okay, so kunwari, in dogs, they have a total of 13 thoracic vertebrae, which means meron siyang 13 rib pairs. So yun, true yan sa lahat ng hayop. Okay? Yan, we have the transverse fovea. Here, fovea is a parang baby fossa. Okay? May transverse fovea siya. And then meron siyang costal fovea. So, pag sinabing costal, it means body. Okay? So, body. Kasi this is important structure kasi yan yung nag-articulate sa kanila sa ribs. Like for example, the transverse fovea, tubercle of the rib yung mag-articulate sa kanya. So, tandaan nyo, transverse is letter T. The tubercle of the rib is also letter T. Okay? Transverse fovea or the tubercle of the rib. Costal fovea naman, this is the head of the rib. Okay? Head of the rib naman yung mag-articulate sa kanya. Now, one structure din na pwede nyo ma-recall o adapt, hindi nyo makalimutan is the anticlinal vertebra. Okay, ano ito? This is the most vertically oriented spine. So, siya yung nakatindig lang, nakatayo na straight. Cranial to the anticlinal vertebra, yung spinous process, take a look, ang kanyang orientation ay pa-caudal, okay, patalikod, or papunta sa buntot. And then, we have the anticlinal vertebra. After that, pa ganun na, pa-cranial, towards the head na. So, in dogs, the anticlinal vertebra is the T11. So, saan mo siya magagamit? Actually, this can be used as a landmark. So, asan ba dyan yung ano? Pag nakita mo ito, ibig sabihin, ito yung T11 niya. So, may mga organs na sa x-ray, ito yung mga organs na dapat nakikita mo sa ganitong level. Okay? So, thoracic vertebrae. Ayan pala. Next, lumbar vertebrae or the vertebrae of the loin. So, ano ba? Ang mga meron lang dyan ay yung orientation ng transverse process, which is cranially, papunta sa head. And then may unique structure sila, that's the accessory processes. Wala naman siya sa ibang vertebrae. And then we have the mammillary process. Meron ito sa thoracic, pero sa last part ng thoracic vertebrae, pero mas distinct or mas present siya sa lumbar vertebrae. Actually, yung sa lumbar vertebrae yung parang hindi siya nabibigyan ng importance among the vertebrae, parang hindi siya sikat. Ayan. But tandaan nyo, okay, may mammillary process siya. So, yun yung mga yun yung dapat nyo tandaan about the lumbar vertebrae. Now, let's proceed with the sacral vertebrae. Take note, meron silang tatlong sacral vertebrae, pero isa lang yung sacrum. The sacrum is the fused sacral vertebrae. So, these are the fused sacral vertebrae at here's a lateral view, a dorsal, and a ventral view. Alamin natin yung mga parts niya. Itong median sacral crest, these are actually the fused spinous processes. So, di ba, sabi ko, fused sila, pati yung mga spinous processes nila, dikit-dikit, and that is the median sacral crest. Okay, this is the median sacral crest. So, may wing, these are the pelvic foramina. And then, tandaan nyo is this, unique kasi siya. We have the promontory. Okay, the promontory or the parang bumper of the, parang bumper siya ng sacral vertebrae. So, wala naman siya sa ibang structures. So, pwede nyo tandaan, saan ko ba nabasa yung promontory? Okay, sa sacral vertebrae. At siya yung harap ng sacrum. So, meaning this is the cranial end of the sacrum, promontory. Next, we have the caudal vertebrae. Again, varied ang number. Pwede nyo palang tandaan, I'm not familiar with the but kasi hindi naman ako nagsa-surgery. Pwede nyo tandaan dyan yung saan pinuputol pag nagte-tail duck. Okay, anong caudal vertebrae level? Yung pwede nyo tanong sa surgery class ninyo. So, caudal vertebrae. At ang unique sa kanya ay meron siyang hemal arc. As you can see here, pwede tanong kasi saan mo makikita yung hemal arc. So, it's in the caudal vertebrae para yung tail vein ay hindi masyadong nasasaktan. Kasi ano na to dulo na to. So, nakapailalim dito yung mga blood vessels sa hemal arc. Again, this is the vertebral column. We have the cervical, the thoracic, the lumbar, the sacral, and then we have the caudal vertebrae. So, this is the vertebral formula for now. Kasi in the coming days, we will recall yung ibang vertebral formula ng ibang hayop. Now, let's proceed dun sa other parts of the bones of the actual skeleton. We have the ribs. Ngayon, let's have anatomical point of view. Ano nga ba yung thorax? Okay, thorax is actually thoracic cavity. It's the space at may mga boundary siya. Sa anatomy kasi we are more on the boundary. Ano ba yung nag-cover sa kanya? So, caudally pala, it is being ventrally, it is being bounded boundary niya ng sternum. Okay, ito yung sternum. Cranially, laterally we have the ribs. Okay, and then dorsally, we have the body of the thoracic cavity. Okay, caudally you have the costal cartilages. So, ito yung sabi ni Pasquini, ito yung mga parang boundary ng thoracic cavity. So let's focus on the ribs. Review lang natin yung ribs. So tandaan natin na may dalawang klase. Actually tatlo in dogs, but may iba't ibang klase ng ribs. So we have the first one, the sternal ribs or the true ribs. Okay. So this is also known as the immobile, hindi gumagalaw kasi nakafix siya sa thoracic vertebra tsaka kay sternum. Kaya siya tinawag na sternal kasi may sternal connection siya kay sternal rib. Then we have the asternal. So we added natanggal yung A, asternal rib. It's also known as the false rib or the mobile rib. So kapag naghihingalo ng aso, ito yung nakikita yung bulat-bulat na gumagano'n. Or kitang-kita nyo humihinga, yung taas-baba. That's the that's the mobile rib or the asternal rib. Bakit siya asternal? Kasi may connection siya kay vertebra, pero wala na siyang connection na direct kay sternum. Dok, ba't ito meron naman? This is actually the costal arc. So these are cartilages. Sila yung cartilage ng vertebra, ng ribs, para dumikit kay sternum. So it's an indirect connection. So costal arc. And in dogs, they have this what they call floating rib. So, wala siya na-connect. Okay? So, floating rib, ang meron lang nito ay dog tsaka tao. Floating rib. So among domestic animals, it's only the dog. So, may total recall yata before. Sinong hayop yung walang or may floating rib? So, it's the dog. So, again, the number of rib pairs corresponds to the number of thoracic vertebrae. So, if we have 13 thoracic vertebrae, we have a total of 13 ribs. Okay, 13 pairs. So, kung i-total yun times 2, that's 22. Alam natin parts ng rib, akala ko yun na, no? So, we have the head of the rib, yung pinakaulo, and this is the one articulating with the costal fovea of the thoracic vertebrae, if you can recall kanina, head of the rib. Then, yan pala, costal fovea. So, dito yung costal fovea. And then, we have the neck of the rib. So, yan yung magkoconnect sa body. And then the shaft of the rib, this is, pag sinabing shaft, technically that's the body of the rib. Then we have the tubercle of the rib. So, this tubercle of the rib articulates with the transverse fovea. So, pag nakakonnect siya, si tubercle, siya yung nakakonect kay transverse fovea. Si costal fovea, siya naman yung nakakonect kay head of the rib. So, siya yung mag-articulate. Now, sternum, tandaan nyo about the sternum is that ang mga bones na nagpo-form sa kanya is what we call sternibra or sternibrae. Segments siya. And the first segment is what we call the manubrium. So, this is the manubrium, first segment. And then the last segment is what we call the xiphoid process. Okay? Si xiphoid process ay may cartilage. Okay? So, xiphoid or xiphoid. Yan. So, yan.
Now, those are the actual skeleton. We have the skull, the vertebrae, the ribs, and the sternum. So, I made a review ng mga structures na yun. If you have any question, I don't know if nababasa ko yung chat or ano. Ayun, yes, question. Okay. Now, let's proceed with the next topic, which is the appendicular skeleton. So, kung kanina actual, now, the appendicular skeleton naman, these are the bones that forms the appendages or the thoracic limb and the pelvic limb. So, yan. So, yan yung ating aaral, appendicular skeleton. So, here the thoracic, we have the pelvic limb. Or, pwede rin siyang tawagin, baka ibahin nila yung front limb. Ito naman yung hind limb. Sorry. Hind limb and the front limb. Next. So, ano nga ba yung mga buto ng thoracic limb? We have the scapula here. So, this is the bone of the shoulder, the scapula. And then we have the humerus, bones of the brachium or the arm. Ito yung arm. Ito, sorry, pinapakita ko. Meron pala dito. This is the arm or the brachium. And then we have the antebrachium. This is formed by the two bones. We have the radius and the ulna. Siya naman yung tinatawag nating forearm. Okay, this is the arm. Forearm naman to. So, dalawang buto, radius and ulna. And then we have the bones of the wrist. That's the carpals. And then the metacarpals and then the digital bones. So, yan. Alamin natin sila isa-isa. Take note that since si Doc ay wala nito, but it's very important na ma-discuss din natin siya. Yung animal natin kasi na inaaral ay quadrupeds. When we say quadrupeds, they are walking using their thoracic limb and their pelvic limb. Or ginagamit nila yung apat na paa nila para panglakad. So isipin nyo, dapat nakakonekta yung buto, yung both of the thoracic limb, both of the pelvic limb doon sa axis sa pinakakatawan. But in most of the domestic animals, hindi nakakonect yung thoracic limb. So meron lang specialized joint and that's what we call the synsarcosis. So siya yung nagdudugtong doon sa itong mga buto na to dito sa ating axial skeleton. Synsarcosis yung specialized joint na yun. Ngayon, sa ibang hayop, they have the clavicle. Ito. So pwedeng nakadikit siya dyan, tapos si scapula ay nag-articulate kay clavicle. That's the collarbone. Yung tayo meron tayo yan, collarbone. But in animals, wala na siya. Okay? So especially in dogs, it became a tendon. That's what we call the clavicular intersection or the clavicular tendon. Ito siya. And the purpose is ano na lang siya, parang boundary na lang siya ng brachiocephalicus muscle. So this is the cleidobrachialis, we'll discuss it later. This is the cleidocephalicus. In between is the clavicular tendon or the clavicular intersection. Pero sa cats, meron pa din pong clavicle. Yung bird may clavicle sila, tayo may clavicle tayo. But in dogs, in ruminants, in pigs and other domestic animals that we'll be dealing in the next few days, walang clavicle. Si dog wala rin clavicle. Okay? So kaya wala tayong matawag na clavicle. Now, first bone is the scapula. This is the bone of the shoulder. So we have the lateral side or the lateral surface and the medial surface. So on the lateral side, let's focus first. It is actually divided by equally yung sa dog by the scapular spine. So this is the spine. And then into supraspinous fossa, this is the depression. Supra means above the spine. So this is the spine above supra. Then we have the infraspinous fossa, yung mas mababa. So dalawa. Meron tayong acromion. So the distal end of the scapular spine, there's a bony projection. That's what we call the acromion. Okay, this is very important for the attachment of certain muscles. And later on sa muscular part, kapag nakumpara tayo, yung mga hayop na may acromion, sila yung may acromial part ng ganitong muscle, deltoideus muscle. Pero yung mga hayop na walang acromion, syempre wala silang acromial part. Okay, so kaya importante alamin natin yung buto muna bago yung muscle. So at the medial surface or side, we have the subscapular fossa. So tatlo yung fossa, supra, infra, and then the subscapular fossa. So we have the serrated face. So dito na-attach si trapezius muscle. Yeah. And then, here we have the glenoid cavity. So the glenoid cavity is actually a shallow concavity. So mababaw lang ito for the articulation of the head of the humerus. So forming the shoulder joint. This is the glenoid cavity. Tatandaan nyo. And then, meron tayong tinatawag na supraglenoid tubercle. Supra again, from the word supra above. Okay? Above the glenoid cavity. Kaya supraglenoid tubercle. Then we have the coracoid process. Part na lang siya ng scapula, but in other animals like birds, separate bone siya, coracoid bone talaga. Very powerful yung bone na yun. Pero in mammals, in quadrupeds, nawawala na si coracoid bone, nagiging coracoid process na lang siya. Yan. So, now, let's proceed kay humerus. So here's the humerus. Meron tayong proximal end. This is the proximal end and we have the distal end. Okay? Proximal, we have the humeral head. So, then lateral to the humeral head. By the way, yung mga head ng mga bones ng appendages, they're actually located on the medial side. So towards the medial kasi sila yung nag-ano ng pressure, sila yung nagbe-bear ng weight, mas functional. So there was a question before kung among the structure, I don't know if this is from a femur or from the entire thoracic cavity. Ang question doon ay sino yung least likely mapudpod, parang maubos or ma-shear. Ano ba term? So ang mga choices doon ay head of the femur, lateral epicondyle, ganyan. Tapos ang sagot doon yung lateral epicondyle kasi nasa lateral side siya eh. Okay? So most of the weight bearing ay makikita mo sa medial side. So yan. Among the choices na pinagpilian. So also have the greater tubercle going back and then the lesser tubercle. So these are bony prominences. Take note, tubercle ay humerus, trochanter naman femur. Parehas lang sila pero magkaiba ng pangalan. Trochanter naman ng femur. And then in between the two tubercles, we have the bicipital groove here, bicipital groove or pwede siyang tawagin na intertubercular groove, meaning in between the two tubercle, intertubercular groove or the bicipital groove. And then we have the shaft, again, pag sinabing shaft, that's the body. And then we have this bony prominence, the deltoid tuberosity. So this is for the insertion of another muscle, deltoid tuberosity. Yeah, another view just to show or emphasize the location of the deltoid tuberosity. Then we have the humeral condyle. Pag sinabi natin humeral condyle, that's actually the general term for the distal end of the femur. Sorry, of the humerus. Okay, humeral condyle. Kapag femoral condyle naman sa femur naman siya. Okay, humeral condyle. And take a look at this. We have the lateral epicondyle and the medial epicondyle. So, medial, makikita mo siya sa side ng head. Okay? And tandaan nyo lang dito ay we have the supratrochlear foramen. Ito rin sa favorite na matanong, supratrochlear foramen. This is an opening unique sa bone ng humerus ng dog. Walang ganyan sa ibang hayop. Tapos wala ring dumadaang structures dyan. So basta butas lang siya for I don't know the reason. Okay? So supratrochlear foramen. Now, next is the radius and the ulna. These again are the bones of the forearm or the antebrachium. So we have the radius. Si radius ay siya yung more massive. Dapat siya yung weight bearing kasi siya yung located medially. Yung ulna naman, siya yung slender na bone. Taller siya, mas matangkad siya actually kay radius. Pero ang purpose niya, meron siyang weight bearing purpose. Pero mostly more on attachment ng muscles yung kanyang role. So first is the radius. Again, may mas massive siya. Meron siyang head, meron siyang distal end. At tandaan niyo, the distal end is what we call the styloid process. Kaya siya tinawag na medial kasi siya yung medially located na structure. Medial styloid process. Now, if we compare that with ulna, Unahin ko muna itong part na to. We have the olecranon process. So kung nakikinig kayo at hawakan nyo yung inyong siko, your elbow, may mahawakan kayong bukol dyan. That's the olecranon process. Okay, that's the point of the elbow. By the way, the point of the shoulder is the greater tubercle. That's the point of the shoulder. The point of the elbow naman, that's the olecranon process of the ulna. Okay? So yan. Then meron na tinatawag na trochlear notch or, di ba dami pangalan, may semilunar notch, na iba pang pangalan kasi mukha siyang half moon. Yan, semilunar notch or the trochlear notch. Siya nag-articulate kay humeral yung sa humerus, sa distal end ng humerus. Hindi na to. So may conchoidal process at meron siyang dalawang coronoid process. Ayan. Ang natanong pala dito ay sino yung mas medial coronoid o yung lateral coronoid process. So kahit ano yun mo, isipin mo na lang, medial, mas weight bearing siya. So siya mas mapupudpod compared kay lateral coronoid process. And take note, coronoid ulit to. So ulit na-encounter si coronoid process. Okay, encounter niyo siya kay mandible. Remember yung parang corona nung ramus, that's the coronoid process. So meron din siya kay ulna. Sana iniba na lang yung term para hindi nakakalito. Then, lateral styloid process naman yung dulo nito. Di ba? If you can recall, ang tawag natin dito kanina ay medial styloid process. Ito naman, lateral styloid process. So, para hindi kayo ulna may letter L, lateral. Okay, letter L si ulna. Tapos, yung styloid ay, di ba, sa yung stylus, yung pangsulat, kasi mukha siyang ballpen. Okay, styloid process. Next. Okay, the space between the two bones is what we call the interosseous space. This is the interosseous space. So the presence of this space make it easier for the animal to pronate and supinate. So yung kanyang ganun yung kanyang kamay, di ba? Especially in cats for grooming, di ba? Yung kanilang palm o yung manus nila pwede nila ipunta dorsally because of the interosseous space. So kapag limited yung interosseous space, hindi nila magawa yung pronation and supination. So as humans, kaya natin yun because we have a very distinct interosseous space. Now, let's proceed with the smaller bones, carpals, metacarpals, and the digital bones. So these are the carpals, these are the metacarpals, and these are the digital bones or the digits. So alamin natin sila isa-isa. Let's proceed first with the carpal bones. For us to review these carpal bones, let me have parang schematic illustration. So the carpal bones is actually composed of dalawang rows. We have the proximal row here, and we have the distal row. Okay, so para ma-imagine natin siya. And for orientation purposes, this is the medial side, and this is the lateral side. Okay, so kumbaga dito yung medial, ito yung lateral side ng aso. So the proximal at the above, dito, kung dito sa area na to, andito kung dito yung medial, anong buto yung nasa taas niya? That's the radius. Okay, this is the radius sa area na to. Dito naman si ulna. Okay, so ulna at radius. So the bones or the carpal bones that articulate with the ulna, ang tawag natin sa kanya, with the radius pala, ang tawag natin sa kanya ay radial carpal bone. Okay, radial carpal bone. Tapos, skip muna natin sa intermediate. Yung bones na nag-articulate kay ulna, ang pangalan niya ay ulnar carpal bone. So, meron ka ng radial, meron ka ng ulnar carpal bone. Ngayon, in between the two, so we have the intermediate carpal bone. Okay, intermediate carpal bone. And then, wala na isang mapangalan, they just call it accessory. Okay, accessory carpal bones. So, in total, we have a total of 4 carpal bones in the proximal row. This is the proximal row. Ngayon, for the distal row, huwag natin pahirapan yung mga mag-aaral ng Batman, sabi nila. Ganito na lang. Ang pangalan na lang nila ay first carpal bone, second carpal bone, third carpal bone, tsaka fourth carpal bone. Ngayon, yung arrangement niya is from medial to lateral. Okay? 1, 2, 3, 4. Medial to lateral. Di ba? Tayo, pag nagbibilang, mali nga tayong Pinoy, pag nagbibilang tayo, di ba? Magbilang ka 1, 2, 3. Ang ginagawa natin ay 1, 2, 3. Mali pala yun. Dapat, ito yung 1. Yan. 1, 2, 3. Pero mahirap kasi 4, 5. Di ba? So, this is the number 1. Okay, ito. This is the first carpal bone. So, sa mga European, ganun sila magbilang. Kung atin ka ng lecture later, pansinin niyo, pag nag-enumerate sila, laging ganyan. First, second, third. Yan. Hindi sila first, second, third. Diba? Pag tinuturo sa atin noon, this is 1. Pero di ba minsan number 1 ganyan. So, nakakalito. Depende sa context siguro. Yan. But anatomically, this is 1. Okay? Ngayon, ito yung perfect na carpal bones. So in total, we have 8 carpal bones. Walo yung carpal bones. Pero si dog, may modification na nangyari sa kanya. So the radial carpal bone and the intermediate carpal bone ay nag-fuse, okay? So forming one bone called the intermediate radial carpal bone. So ito siya, ito yung malaki niya. And that's the largest carpal bone, intermediate radial carpal bone. So another schematic illustration just to show you yung arrangement. So this is the fused radial and intermediate carpal bone. Meron pa rin siyang ulnar carpal bone, accessory carpal bone, and then the 1, 2, 3, and 4. So in total, meron lang silang 7 carpal bones. Pero sa perfect na hayop, which is present sa pig, 8 lahat dapat yan. But in dogs, they only have 7 carpal bones. This is the intermediate radial carpal bone, the ulnar carpal bone, and then we have the accessory carpal bone here. Ito yung actual na buto. Yan. Second, third, fourth. Okay, so yan yung mga buto na yan. Next, for the metacarpal bones, ang kwan dyan ay para madali yung tandaan, meron default na 5 metacarpal bones. So, lalo sa kumpara, 5, pero nagkakaroon lang ng mga modifications. Okay, so yan. So, ano yung mga carpal bones na yan? Metacarpal bone 1, 2, 3, 4, and 5. Sa board exam, I don't know if paano yung mga gagawing sa inyo dyan. Baka hindi niya sabihin metacarpal. Kasi pagka nabasa niyo yung M na malaki, tas letter C, so it is referring to metacarpal. Tapos, ang pagsulat sa kanya ay Roman numeral. Kaya ito, metacarpal 5. Okay, so 5th metacarpal bone. Kapag metatarsal naman, MT, ang pangalan niya, MT. So, si metacarpal meron siyang base, siya yung nakakonekta kay carpal bones. Baka pwedeng tanong, bakit metacarpal yung nakakonekta kay carpal bones? Sa base. Ano yung head, diba? This is the base. Ano yung kasi meron siya head. Okay, pero hindi head. Hindi na head. Hindi na bones. Okay, so I don't know bakit. Basta base, hindi head. Okay, base, body, and head. So, yan. In dogs, they have 5 metacarpal bones. May metacarpal bones siya, 1, 2, 3, 4, 5. And pwedeng tanong sa mga weight bearing niya. Ito yung mga digit. So, each digit, sa metacarpal digit, ay pwedeng kinuha ko siya ng tatlong buto. So, yung proximal, the middle, and the distal phalanx. Okay, so yung mga metacarpal bones, meron siyang tatlong digital bones. However, in the case of digit 1, meron lang siyang dalawang phalanx. Meron lang siyang proximal phalanx na yun. Meron siyang proximal phalanx, tsaka meron siyang digital phalanx. Ang digit sa kanya ay middle phalanx. Okay, so, para mag-pwede niya. Yun yung board sa kanya. Ang English kung balik kasi yan. Ang digit mo makikita. So, proximal, middle, or distal. Obviously, meron siya sa distal phalanx. So, kung ito, so ito yung parang bone projection. Ito. And then meron tayong process ito, yung mas mabilis. Okay, ito yung kinakabayan ng nail or yung block ng aso. Kaya sa usap, you have the process. The glowing, yung makikita ko. Pwede kang dyan, ay ang pwede kang dyan. So, distal phalanx. So, yung procedure niya. Yan, iiwalay yan. Hindi na siya makapag-ano. Hindi na makapag-yung kanyang claws. Okay, so, ano yung mga process. Pero ang welfare, hindi siya ginagawa. Ano, diba? Moving forward, now, sa bones of the racilium, the bones of the racilium, record natin yung mga bones na yan. So, we have the coxae or the bone, followed by the femur or the bones of the thigh. Take note na ito yung thigh. Yung alam, is the leg, ito yung thigh, okay? So, then followed by the bones of the leg, that's the tibia and the fibula. So, followed by the, part of the digital bones. Coxae or the bone, is actually here, so may tumuto, we have the ilium. Yan, ilium, take note sa spell niya, eye. Kasi ang ilium, that's the distal and the ilium. Ilium is the largest bone of the wings, etc. Then ischium is the caudal floor. The floor, caudal. Kasi meron tayong cranial floor, that's the pubis. Okay, so you have the wall, yan, the ilium, cranial roof, then you have the floor, is the ischium, caudal floor, and then the proximal, cranial floor is the pubis. Also, the acetabular. So this is a deep cavity, the acetabular, where the head of the femur is articulating the acetabular. Originally, embryo, yung sustainer sa ato. The ilium, the ischium, the pubis. And then additional acetabular bone. Originally, meron tayong kailangan, wala na. So, wala sa acetabular bone, naging acetabular siya. So, meron siyang little lobe, acetabular, acetabular, dyan naging acetabular. So, you have also the ilium, the ischium, and the pubis. And then they're refused by the pelvic system, and we have the pelvic system. And we have the largest foramen in the body, that's the obturator foramen. So, obturator is foramen. So, the dorsal nucleus shows the ilium and its part. We have the cortex wing of the ilium, is the wing. And then meron siyang body of the ilium, wing and body. And then ischium here, and then may body of the ischium, and it's sciatic bone there. So, alam mo, tinanong, look at the parang may idea sa imagine, natin sa map na inorder natin kung nakikita niya. Parang nagawa na question ko sa idea, yung tanong, okay, yung question, gagawin natin. Minsan nakaka question, kasi alam natin yung actually, yung question ay yung mga clue ninyo para masagot yung choices, okay? Isipin mo ang pinili yung question, gawin yung mindset ninyo, mas madali yung question. Imagine mas friend mo siya, mas siya kahit, isipin mo, mahirap siya. Alam mo kasi una nakikita ng brain mo na mahirap siya. Yan, so pinili mo kasi yung question. Ano, tapos kasi natin yung tuber, mabuhay promises. So, tuber sa kali here, tuber sa kali, kasi siya yung nakikita kay sacrum, okay? So, sacrum, may tuber na dito. So, the sacrum, the tuber coxae here, so siya yung nakikita natin pinbone, okay? Then we have the tuber sciaticum, okay? Tuber sciaticum, so, tuber sa kali, tuber sciaticum, and tuber coxae, yan, so. Now, let's proceed with the femur. That's the bone of the thigh. Okay, thigh part chicken femur yung bone yung leg. Okay, so siya yung typical na description ng head ng lobe. Okay, so very head. Hindi siya kapatid kay Uterus. Kasi Uterus yung head. Nakalimutan natin sa femur. Parang yung head. So yung siya malamang siya sa surgery. Tinatawag yung head. Yan yung procedure. Femur head. Ngayon si may maliit na depression. Fovea penis. Yung sa femur head. Diyan kasi na-attach yung ligament para makapit siya doon kay acetabular. Okay, so fovea penis. May nakakita kasi acetabular sa femur head. May pagdumi ko dyan. Yan, bumaba siya dyan. Yan naman yung siya. Yung cosmos siya. Yung malaking bina na aso. Then, meron siya great cutter. Ang cutter sa ay great cutter. And then we have the lesser cutter. So meron siya tawag na cutter fossa. So it's fossa in English. So yung cutter siya ng Uterus. Iba ng pangalan. And then we have the cutter. Parang cutter yung curiosity. So great cutter. Prominent sa dog. Sa yung great cutter. The body shaft. Then mga lips. Lahat ng tayo ng yung pinakita niya. Kasi head. Ano yung medial side. Okay, medial condyle. So yung fossa. Yung view. Meron tayo ng femur tokya. Kasi yung sa may boat na lesser sa may boat. So femur tokya. Patella surface. Aside from that, may sa may boat nito. So ito yung femur condyle. Yung may dalawa sa may boat. So yung patella. Okay, so yung side dog. Tapos harap meron siyang patella. Okay, so dito sa patella. Okay, ng dog. Now, tibia and fibula. So this is more massive. So this is also medial location, weight bearing. And we have the fibula, very slender, from to parang hindi mo naman siya. Kasi kapaan na or something fibula. So mostly more naman siya fibula. Siguro pag nag-ibig tao or yung parang fibula. So meron siyang fibula. Yan, fibula. Yan, meron natin. So meron siyang cranial curiosity, sa fibula crest. So sa last class ko, yung parang ako sa mga parang kubilang na part, parang tayo sa fibula crest. Yan, fibula crest ng tibia. Then may for the attachment for the articulation with the condyles of the fibula. Tawag din natin medial condyle. Naman medial condyle femur, medial condyle femur, medial condyle fibula, medial condyle fibula. Now for fibula, head, tapos lateral malleolus power sa dulo. Si ano sabihin? Ito naman malleolus yung pangalan ito. Ang pangalan medial malleolus, medial malleolus. Ito naman lateral malleolus sa kanya. Okay, so fibula. Let's proceed sa tarsals. Tarsal bones. Single tarsals. That's the bones. Pero ganyan sa kanya, medial lobe, medial lobe. So sa proximal, medial and distal lobe. Sa proximal lobe lang okay. What articulates with the tibia, medial side. Pangalan ay tibial tarsal bone or the talus. Okay, tibial tarsal bone or talus. Ito naman isa kung fibula, pangalan niya ay fibular tarsal bone or we call that calcaneus. Okay, calcaneus. So sa distal lobe naman, pangalan naman siya ng first and fourth. So the first tarsal bone, second tarsal bone, third tarsal bone, and the fourth tarsal bone. In between, so kung siya yung mga carpal, meron tayong central tarsal bone. So this is the general arrangement ng tarsal bone. So meron yan 1, 2, 3, 4, 5, 6, 7. And yung carpal we have 8, si tarsal we have 7. And this is present in dogs. Wala mong ginagawa. Yes. Yung arrangement nito ay function side dog. So perfect side dog sa tarsal bone. So this is systematic showing the talus, calcaneus, central, the first, second, third, and the fourth. The fourth is the largest in the distal lobe, but in the proximal lobe is the talus. Yan, so just ang buhay. So the talus, the calcaneus, then you have the other bones here. Now for the distal bones, so the tarsals and the distal bones, they're actually the same with the bones of the thoracic. So in the arrangement niya, si proximal si metacarpal bone 1, dalawa naman yung radial bone. That's the proximal and the distal lobe. Ngayon ang functional metacarpal bone ng 5. So yun siya gamit. Pero kailangan yung julo, siya yung sa first digit, okay, first digit julo. Ngayon sa amin board, if you are familiar with this board, kasi buong siya sa atin. Yung mga yun siya okay na. Ang tayo nasa julo, wala lang lang. Tapos yung exam, yung exam for exam. Ano, hindi ko siya get. Parang yung exam. Tapos yung board exam, pag lang sa kanya. Luckily, yung exam, parang yung siya yung question sa board, if you have a board, please board, baka yung mga question. Pero mas experience namin yung mga question. So sa exam, alam mo siya. So parang you have to study, yung siya yung memory. Kami lang okay na ng So, we have no students sa business but for now we have 10 minute break, we go to the bathroom or ano, pwede tayo discussing. Bigyan tayo ng 10 minute break. Now it's 10:32. We got time for you. Zoom parang para sa yung super we should do something different. Let's discuss it ng mali para yung okay? So, break tayo for 10 minutes para after 10 minutes. 10:42. If you have a question, for you know para mag-discuss, okay? Okay, yung move or yung stretching ang yung stretching yung board ano kasi din sa muscular system. Ako natin highlight na natin natin sa mga muscle. Yun na, safe na sa muscle. Tapos yung origin insertion ano, kung pwede siyang review or analyze, pero kung ano naman yung siyang focus yung power yung origin insertion. Hindi siya magdala ng okay, so yan yung natin. Next. Muscular system again, may goal is lang. Kaya lang mostly muscle di muscle para malala. Para siya so we let yung muscle head, okay, muscle body thoracic region, muscle thoracic limb, and muscle thoracic limb. So hindi lang yung muscle lang. So as here, alam natin ano, tendon, muscle bone, tendon. Okay, so this is example tendon, pero associated with flat muscle. Parang ano, yung right silver or the silver like sa aneurysm, na muscle muscle. Then origin insertion, origin less movable, insertion more movable actually. So pwede naman siya yung muscle region or sa distal. So yung thoracic origin insertion. Again, familiarization pwede gawin sa origin insertion, pero pag ang bone is kasi kung ko hindi so hindi ko so yan. Origin insertion. Belly is the fleshy part of the belly, so yung muscle. And then intrinsic muscles, so muscle belly natin. So intrinsic muscle, pag muscle yung origin insertion ay lang sa thoracic region, thoracic limb. Intrinsic muscle, yung muscle tang, may insertion sa manakayod, tapos yung muscle tang, tawag natin intrinsic muscle. So you have one body. So intrinsic muscle. Let's go deep superficial etc. Yeah, muscle head, divide natin several different function. Para sa tayo magugutan okay, divide natin. First muscle mastication. So these have attachments to the wall and yung attachment niya is associated with joint. Okay, facial expression naman yung mga ang pagkakata siya, yung some expression, they also must make muscle, so yung mga muscle facial expression. And then other muscles, just classify by expression. And the muscle mastication. So the muscle mastication Ano yung mag-work sa mga relationship ako, to work sa mismo mga session dito. Siguro ako sabi ko, for sign kung ano, pero ako mas ako work sa ano lang mindset lang. Ang question ang yung question, sure ako kung ako work sa ano. May question is what's the only master that opens the door. Sure that's the next ko. Kaya kasi sa ano siya, ano pa rin ano. Kaya yung mama, itik niyo sa inyo. Kami tapos inyo kasi ang work. Sa yes na email ang work. Ako passing lang yung ano. At the daily sa inyo. Okay, so even ang work. Like change siya. Ano ko sa inyo. Yung ano yung nila sa sila. Mismo work sa inyo. Yung mga tapos. So paano yung video, sige niyo, nila, sige niyo, ano taking pinaka mga work. Ay post sa Facebook pagano sa work. Sa paano magano yung gaano yung sa Facebook. Dili nila so, you know, talaga mga mga papalo mo na sige niyo, ano gagawin ko pagano. Sige niyo, tira tayo. Kaya. So, kung sa next okay, that's close. Kasi yung mga gravity. So may mga gravity so sa next. So next so analyze sa mandibol. Sige sa mandibol. It closes the door. Okay, so mas maling pa sa gravity. So mas para itaas. Kasi sa gravity. So next one, then the price so mas force yan. Sa force siya. It closes the door. Then the price. Then the price na yung price. Para next sa movement. So yung mga siya gagawin. So most is movement. So yeah, sa movement. So yung force. Yung sa force. Pero yung function. Now, we want muscle application of the fourth. The next the master the price and the you know now for the muscle expression. So we have the muscle cheek, okay? Muscle cheek and then muscle lips. Muscle forehead, muscle eyelid. So parang muscle cheek, muscle cheek. Muscle lips na like smile. It's smile. Yeah, it's continuous muscle. So sa continuous ano siya manipis muscle, continuous muscle siya. So muscle muscle head. Normally kaya siya. Kasi sa skin. So parang continuous muscle lips. May continuous muscle na sa continuous strong muscle. So imagine yung mga langaw okay sa kanya. Yung kanyang gilid ay kontak sa kanya. Yung yung mga insecto. Kasi continuous muscle. So continuous strong muscle. Manipis muscle siya switch. So hindi ka muscle for expression. Pwede yung yung angle flex only condition. Pag yung naman parang continuous muscle. And then boxing is na continuous substance nila sa boxing. So nasa ilalim ng guys also. Ito naman yung muscle. So sorry ano ang dollar sa muscle sa boxing. So yan boxing. Muscle lips na mas mababa. Muscle lips. Pwede nasa guys. So pwede nasa lips elevates pinaka niya. Nasa guys meaning is or ano siya sa lips. Okay. Cause nasa lips ng muscle. Nasa guys. So nasa guys sa lips siya yung nasa upper lips. So nasa guys. Let's all guys for this one. So if I surround the round so all guys surrounds the lips also. So ilalim ng boxing so ilalim ng boxing. Now third is the second smiling. Okay, smiling muscle. So ito na actually kayo condition kung ito parang makasang dito. Especially boxing. Parang reading siya yan. So next, we have the muscles of the facial expression, the frontalis. So frontalis yung mentus, chin, sa baba, frontalis. So yung muscle niya, sa division of the boxing. This is not referred to. So for example, if you give me one species, parang they're asking about anatomy of the dog. Kasi every person ay dog. Yan. Then maxilla muscle para sa kasing daming term. Maxilla means maxilla, naso, nose, area, the lips. Okay. So maxilla muscle divided into two portions. We have the very large portion, and the portion. So we have the mga ano na maxilla muscle. Siguro, these already siya makikita. Okay. And then forehead, so ano yung body, so frontal bone, so frontalis. Okay. So yung muscles of the lateral muscle, frontalis. And eyelid, so yung nasa dyan ay the ocular oculi. Yung ocular oculi here. And ang nasa ocular oculi. Okay. So the feature. And then the lateral ocular oculi. So ipasa sa lateral ocular. So yung sa mga ocular. So meron na lateral ocular. So yung lateral ocular. So the cells is the core. Okay. Ang ocular the eye part of lateral. Kaya pag gusto mo i-check yan. So yung natin sa lateral ocular. Then yung upper part, the lateral ocular. Ito naman yung mura. Okay. So medyo dyan para ito. So ito si lateral ocular. Ito naman si lateral ocular. So kapag siya ginagawa niya, kunyari, meron siya na pag-ibig si dog. Now, extra ocular muscle yung sa next ocular yung sa sila ng eyeball. It's responsible para yung mga eyeball ko para sa mga sa eyeball or tumatawa ang yung mga sa extra ocular. Meron tayo ang 2 3 4 5 6 muscles. The first one is rectus. So rectus, kasi rectus. Rectus means straight. Yung fiber relation is straight. So basta kung may elevate sa loob. Kung hindi mo mga sa ibang sa rectus. Gusto mo mga yung okay, that's ventral rectus. Okay. Gusto mo mga sa katawan sa side mo that's lateral rectus. Kapag gusto mo magbilin nila that's medial rectus. So meron tayong rectus muscle, dorsal, ventral, lateral. Yan, para kung straight yung fiber relation niya. Meron tayong dorsal oblique yan para oblique muscle relation. So dorsal oblique muscle, then we have the ventral oblique muscle. May cover siya. So yeah. And then we have additional muscle, yung pupunan ng muscle. That's the upper oblique muscle. So yan. So meron tayong we have a total of 7 extra ocular muscle. 4 rectus muscle, 2 dorsal oblique muscle, and 1 lateral. So lateral oblique. Yan, ganyan siyang tanda. Now, next ay tongue muscles. So we have the tongue muscles na to. And tandaan niyo na pwedeng increase muscle yung tongue. Itong mismong tongue muscle na to, yan, yung tongue or liban ng tongue. That's what we call increase muscle tongue. That's yung okay muscle niya. Yung linggo bahagi sa mga muscle. So increase muscle yung tongue niya. Meron tayong increase muscle yung pagdalaw ng tongue. So we have the styloglossus, the genioglossus, and the hypoglossus. So para naman kayo ano, sa nose niyo, ano ginagawa ng genioglossus? Yung direct or siya yung maintaining sa position ng tongue in place or siya yung parang punch mo yung abdominal. Pero yung ginagawa sa inyo. So yung muscles niya, meron na silang function. So genioglossus, hypoglossus, and the styloglossus. Now, let's proceed sa head. We'll sa neck and back. Okay, neck and back. So meron tayong mga action muscles, hypoglossous muscles. Ano yung mga difference niya? Yung action muscles, these are the muscles na we have an illustration. The spinous process and the transverse process. So anything above the spinous process, so above the transverse process of the vertebra, above the action muscle, okay, action muscle. And anything below the transverse process, we call this action muscle. Ngayon, ang action muscle ay ano yung structure ay vertebra na divide by action muscle. So given na sinabi yung second is the transverse process of the vertebra. Okay, so anything above here, action, anything below action. So below yung above below yung action muscle. Let's take a look at action muscles actually. So we have the muscles yung blue, yung orbital, and the green. So these are action muscles. Ano ang action system siya na ibang muscles. Okay, so yeah. Una is ang kailangan most medial unit. Ito is the transverse spinalis system. Okay, transverse spinalis system. Ito naman or middle most among the three action muscles. Ito yung longest, ito yung longest system. So yung mga nila ay nakalagay sa for example, so the most lateral iliopsoas system. Okay, nasa region siya ng thoracic vertebra. Ang mga iliopsoas. Okay, so nasa region siya iliopsoas lumbum. Okay, so nasa tatlong action muscle, that's the transverse spinalis, the longest iliopsoas system. At yung sa region siya nakalagay. Nandun sa most lateral, sa middle, most medial, sa longest. Yan, so may action muscles na. So yung gross region niya, the most medial, pinaka sa axis of the transverse spinalis, yung longest and the iliopsoas. Okay, so tatlong action muscle, that's the transverse and back. Yung ulit siya. Yan. Tapos flexors, ano yung flexors? So first is action, so flexor, flexor man siya. Okay, so what is action muscle? Manong muscle yan. Manong muscle yan, action muscle. So valgus, so valgus. Medyo nakalimutan ng muscle kasi extensor siya ng region, pero flexor siya ng region. So kung kayo, hindi siya memorize as flexor extensor, but divided into that way para maigayo kung ano yung niya. Pero ang tandaan niyo lagi, saan siya kayo ng kayo. Extensor valgus, it means it's a muscle that extends from the sternum, so mula sa magbubing, sa valgus to the head, from the head. Okay, so valgus from the sternum to the hyoid apparatus. Okay, so valgus naman from the sternum, valgus from the hyoid, okay, yung sa hyoid apparatus specifically sa hyoid, sa ano ito, hyoid cartilage. Okay, then sa valgus, sa limpa cartilage ito. Yeah, now punta tayo sa abdomen. So ano yung apat na muscle abdomen. So at yung kanyang muscle fiber coordination. So meron external abdominal oblique, yung internal abdominal oblique, the rectus abdominis and the transversus abdominis. May mga ano dyan. Sino yung pinaka deep, sino yung most superficial or yung muscle fiber or yung surgical approach. Sino muscle yung mas lagi hiwa mo kapag ang approach mo ay yung dito. Okay, so yan, so meron nakita ko rin. External abdominal oblique asan siya. So yung external abdominal oblique is the most superficial muscle fiber, mas among four abdominal muscles. Tapos ang coordination ay cranial ventral. Yan, so para ano. Now, susunod naman ay si internal abdominal oblique for coordination is external. So reflect lang siya, reflect. Ano parang parang gano'n, yung ginawa. Nakakatawa kasi, yung sinabi ko online class, nakakatawa question na, how do you reflect yung mga hindi nila reflection. Okay, so yung explain na yung reflect, the lab class, so hindi siya online lab class, so hindi mo madali makapag-reflect yung mo siya. So, yung explain na reflection, usually yung reflection, so parang siya, so reflection. So, imagine nyo, with this system, sa thoracic cavity, meron tayong bone na nag-support ng lungs, lungs heart, yung sternum, yung cage para nakain cavity. Pero sa abdominal region, wala din sa abdominal. And abdominal cavity holds heaviest muscle, yung intestine, stomach, liver, diba? So, dyan ang bigyan ng muscle. And wala nang bone support doon. So, yung mga hayop ay ng dalawang paa. So, dapat yung abdominal merong strong muscle na nag-form or hindi siya kaya muscle fiber rotation na iba, like siya strong, okay? So, ito na yung direct abdominis. Yung direct abdominis, muscle fiber rotation is against straight tayo, okay? So, from brain alcohol, yung rotation, and yung rotation, meron siyang mga infections. So, yung infections, ito yung abs, okay? So, yung form yung mga component, okay? So, because of the infections, yung mga yun is direct abdominis yan. And then the most, deep or deepest muscle is the transverse abdominis. Muscle fiber rotation is the transverse abdominis. Yung muscle fiber rotation na transverse from left to right, okay? So, this is the most deep or deepest abdominal muscle, transverse abdominis. So, yung lahat sila ay merong, parang, tawag dito, dugungan sa white line dito, sa bali na, okay? Yung abdominal yung hiwa kasi, ang mga nagawa siya ng vessel, okay? So, yung hiwa na natin. Na muscle thoracic limb, pwede natin i-divide siya into shoulder girdle, shoulder joint, elbow, carpus, digits, okay na yan. Ito na tayo sa shoulder girdle, okay? So, shoulder girdle, may tissues, lahat ng tissues. Tapos yung itsura kasi siya, yung tissues cervicalis, mas malaki cervicalis kasi, iwas na siya. Siya yung imagine sa yung scapular spine, ito yung spine ng scapula, na-insert dito, tapos dito, okay? Then yung parts thoracic, tissues thoracic, yun naman siya, so, thoracic cavity, yan, thoracic vertebra, yan, tissues muscle. Rhomboideus is sa bulk muscle, pababa siya, dito sa neck region, yan, so, sa bato pala, ako na yung, ito sa shoulder girdle. Meron tayong pedis kasi part or region siya, rhomboideus nasa head, cervix nasa neck, tapos thoracic nasa neck, ay nasa thoracic vertebra, so yung mga rhomboideus nandito siya sa area natin. Yung thoracic so, ito sa muscle, so yung fan shape ng so, yes, may thoracic vertebra, kasi thoracic then the transverse so, this is also a big bulk muscle, actually big muscle ito, so, now, shoulder joint naman, so, we have the brachiocephalus muscle, the brachiocephalus muscle is the outside niya, it extends from the vacuum to the vagus, up ng head cephalus, at the divided structure again, that's the divided structure, the tendon. So, here's the divided tendon, okay, yung is the polyp so, pressure vacuum, and above that is the polyp okay, so, ang polyp is brachiocephalus niya, so, it depends on insert, so, in box, meron siyang insert, tayo, muscle, temporal bone, sa meron siya sa neck to cervical vertebra, kaya ang neck cervicalis, yan, so, yung polyp yan. Then this is the polyp section. Other muscles are the supraspinatus. Ito yung muscle na nakikita na kay supraspinous fossa. Okay, meron siya sa supraspinous fossa. Supraspinatus. And then the latissimus dorsi, that is the most broad muscle of the shoulder, neck, and back. That's the latissimus dorsi. Latissimus means parang wide. Okay, so latissimus dorsi. Take note, pag nilalaman natin sa latissimus dorsi, saan ko lang makikita sa supraspinatus muscle. Okay, meron natin sa next is the deltoideus, flexion tayo, deltoideus. Sa mga deltoideus, ito yung parang deltoid yan. So, meron siya deltoid yan, so, nakita siya yung scapular part and acromial part. So, yung acromial part, yung scapular part ng deltoideus. Yung hayop na walang acromial part, scapular part niya, deltoideus ang general yung pangalan ng muscle niya. Okay, so next yung infraspinatus, yan, infraspinatus yung nakikita infraspinous fossa. Then teres major, and teres minor, yan. So, yung teres infraspinatus, and teres major, another view siya. So, this is the shoulder, yan. So, yung minor, yan. Adaptor, sabi natin adaptor, these are muscles naman, parang pinipit niya yung thoracic, yung thoracic, paano sa midline adaptor. Pag adaptor, alas, he was adapted. Adapted means parang tinignan, parang or hindi mo siya. Pag naman, pinipit mo siya, yan. So, yung adaptor, so yung pectoral muscle, yung pectoral, kasi nakikita yung pectoral, yung superficial pectoral muscle, and superficial deep pectoral muscle. Ano yung deep pectoral muscle? Superficial muscle, nakikita siya, depende kung ano yung muscle fiber rotation, diba? Yung so, we have descending pectoral muscle, so we have that transverse pectoral muscle. So, they are part of the pectoral, superficial pectoral muscle. Ngayon, si deep, si deep pectoral muscle naman, siya may ascending pectoral muscle. Okay, so ascending pectoral is deep, si superficial is descending, and transverse, so yeah. Other tapos subscapularis, so subscapularis yung nakakapit kay subscapular fossa, nandito siya, and then coracoidalis muscle. Now for the elbow joint, yan, elbow joint, biceps brachii. So ito yung naging circle, yung what's the strongest extensor of the elbow? So the biceps brachii muscle. So from the biceps brachii tatlo, three heads, three but hindi mo na actually we have four heads in the biceps brachii. When other animals have dogs, we have four. So siya may long head, so may long head, may lateral head, may long head and lateral head. Then we have medial head, we have accessory head. So yung head ng biceps brachii, long lateral medial accessory head. Ano yung common sa hayop? This long head, lateral head, medial head. Accessory head yung missing iba. So yung lateral brachii, so wait, sa kuha yan, siya long head, so biceps brachii is unique to the dog, that's the accessory head of the biceps brachii. Ang conduce accessory siya, yung sa elbow, elbow. Yeah, conduce muscle. Then the biceps brachii, so the biceps brachii, conduce and the biceps brachii. You're I think na divide mga accessory siya, no? So yeah. Flexor naman, biceps brachii. So biceps yung flex, so flex yung so mga si biceps brachii, flexor siya ng elbow. Then the biceps brachii, so and then the take note na extensor ng elbow, little flexion ng elbow. Yung muscle, ang yung major role niya, yan. No, active opposite digits. So we have the four muscle, yan. So yung ectu, ito sa muscle, ectu means yung ECLU, okay. E stands for extensor cardialis, so extensor cardi, yung una, yan. Most cranial muscle, extensor cardialis, and then the common digital extensor, yung common sa lalang digits. And then the lateral digital extensor, and the extensor cardi, yung apat na sunod, so yung muscle niya, then try ano, hila yung mga muscle niya, yung mga digit yan. So makita mo. And then the additional ito, extensor cardi obliquus. Kasi yung obliquus ito, oblique yung oblique yung arrangement. Makita mo muscle ng direction, yung abdomen, upper position ng gusto, or upper digit 1. Yan. So extensor cardi obliquus. Flexor yan, extensor cardialis, extensor cardialis, so digital flexor, and the digital flexor, so yung flexor sila. Now you see sa muscle ito, this one, yan. So yung sa joint, sa side fold, and the side fold is the knee, yung fold, face fold, and then the hock, and then the digits. Yan. So muscle on the hip joint, so we have the extensor cardi. Meron tayong tawag na hamstring muscle, diba? So hamstring muscle na function ng muscle, three muscles. So we have the biceps femoris, yung most superficial biceps femoris yan. Ito siya, ang bago ng sa likod, diba? Pwede ng sino mga tawag muscle ng tayo. Kung ano yung example, wala ko klase. Ano yung hirap? Pero ginagawa ko, nalagyan ako ng muscles ng coronary, hindi lang ng muscles thoracic. So this like yung mga muscles sa kabilang kamay, kabilang side. So yun, sa kabilang kamay ng question. So isa, biceps femoris, follow by the yung semi muscles, and then most medial, the semi membranous. Yung medial membranous, yun lang yung so hamstring muscle. Biceps femoris, semi muscles, semi membranous. So yung muscles mo sa hindi sa hamstring muscle. Bakit? Kasi makakalito, yung mga medial na para dito yung pero medial division si femoral artery may siya. Yan may mga picture. So like yung hamstring muscle yan siya. Middle gluteal, so kanina si middle gluteal muscle yan. Sa picture and then siya dito. So biceps femoris, this is the middle muscle. So tapos naman yung sumunod na so superficial gluteal muscle, superficial gluteal muscle. So I think this also include the deep. So kapag natin si middle gluteus, so nakita si gluteus profondo, deep gluteal muscle. So kami dito natin sila pero para sa expression niya pag profondo sa deep gluteal muscle, deep profondo sa superficial, superficial yan. Medius deep natin. So that's what I did. So that's what I did. That's what I did. Then mga tapos yung this is the medial side of the profondo precis yan. Then you have the penis, this is the spindle shape muscle, yung description niya. Yan. And then you have the adaptor, the adaptor, and then quadratus femoris. During summer call, may question doon about yung femoral triangle. Okay, femoral triangle. So femoral triangle is this one. Yan. Yan, triangle yan. Kasi dito sa femoral artery, or femoral vein. In the case of this one, si artery ay mas mataas compared kay vein. Normally, si vein may mas superficial kay artery. Kaya nalala ko ng blood. So si vein. But in the case of this one, si femoral artery mas superficial compared. Femoral artery is mas superficial than femoral vein. Ano yung addition? Pwede mo mag-collect ng pulse. Okay, so femoral artery. May landmark dyan sa femoral triangle. Okay, so ang cranial boundary is sarcoidosis, sarcoidosis. Okay, and then ang caudal boundary, border is epicnus. So ang minimize ng sarcoidosis, sarcoidosis. Yan ang siya, kung cranial boundary is sarcoidosis, caudal boundary is epicnus. Pero ang sa amin parang ay no design mo. Ay no, ano yung medical importance? Medical importance ng femoral triangle. So ano yung medical importance ng puso? So yun sa for election pulse, yun yung medical ng nucleus. So yung tanong kayo, sinilate ang anatomy. Yan. Quadratus femoris yan. Sarcoidosis sa sarcoidosis sa dog hatchet. So the part and then the caudal part sarcoidosis. So yung ang minimize dito sa yung pang nanay. So kung ano nilagay yung I have read yung muscles yan. Yung ano nilagay yung muscles. Sarcoidosis muscle yan. Ito ba? Ito ba? Pero that's dito yan. Hindi na mahalaga. Kung hindi ka naman, yan. Okay? Ang siphon, again, siphon means the need. Yan. Yung basic na ano ano boiling of the siphon. Okay? The siphon is actually the region is supposed to be the framework and the proximal row of the ila and the fibula. Yeah, so it's the siphon. Yung ila okay, yan. Yung ila. So siphon, we have the biceps ng biceps symbol siya. Six expression siphon. Kanya expression siya ng siya. And then the A, and then quadriceps femoris. Quadriceps femoris, siya yung natin before. Quadriceps before, sex instead. Meron siyang vastus fibularis, rectus femoris, the vastus femoris and the vastus fibularis. So yung natin quadriceps femoris. Yan. Flexors yan. Flexors siya. Ang muscle, gastrocnemius and esophageal flexor. Oblivious, dulo ng siphon, that's oblivious muscle. And then hack naman, so we have the muscle ng hack. Ito yung hack. Yeah, yeah. So this is the tibia and the fibula. This is the metatarsal bones. Yan. This is the hack. If you can see here, this is the acromius. So this is the fibular tarsal bone. And this is the tendon of Achilles. Common kanina tendon. So if you're familiar with Achilles, sorry, dami yun. So first the gastrocnemius. So the gastrocnemius ay yung stomach shape na muscle. Kaya gastrocnemius, stomach shape muscle siya. Tapos yung kanyang tendon ay nakatouch dito. Gastrocnemius. Kasama nila gexi. Dito. Superficial digital flexor. So like part of gastrocnemius, superficial digital flexor. Yung tendon na form nila, common kanina tendon or tendon of Achilles. So ang tendon muscle yung form ng common kanina tendon. So gastrocnemius na superficial digital flexor. Magkasama muscle yung kambal. Kung gastrocnemius siya yung epicilium, laging mag-pair. Yan. Tibialis finalis, hindi na masyadong long. Ito ang yung ano. Yan. So, this is the time for the digestive system. Sorry, yung part na yun, malalaman siyang i-cover. Kung hindi naman yung review. Paano yung muscle? Kung kasi yung gugulin siya kasi, kung dalawa sila doon, hindi naman okay yung paano hindi siya kasi ano, 1 point lang yun. Okay, 1 point lang yun. Yung point ng hirap, sino sa point ng mali. So, focus sa mali. Ay, one time, sabi yung support, sila yung support, sabi yung sunod sa niya. Lahat ng doon sa basic. Kung ano yung basic na physical knowledge niya. Kung sumata, malala ka. Kasi doon naman nakakalo. Okay, lahat yung basic na yan. So, kung sumata, mag-effort para, ano yung mahirap. Kasi, parang dito sa hindi na, bawal na. So, which is the digestive system. The system is actually divided into 2 and 2. Power digestive tract, yung naan ng kain. So, sumata naman kain. We call it digestive tract. At yung digestive gland, yung produce enzymes ng secretions para maka-aid in digestion. So, actually, galing dito sa liver gland, the liver, and the pancreas. So, first is oratory. Siya pinaka-isang parang digestive tract. Yung oral vestibule. Oral vestibule is the space between the legs and the teeth. Wala yung teeth for ngayon. Ano yung dilano sa bitan ng inyong ipin at ng inyong lips. Okay, so ito. Yan. That space yung divided para sa oral vestibule. Okay, so oral vestibule is oral vestibule and oral cavity proper. Kung saan yung dilano ng dilano sa oral cavity proper. Okay, si oral vestibule is divided into 2. So, between the legs and the teeth, that's the double vestibule. Pero kung dilano sa gilid, that is, yan, sa gilid, that's the buccal vestibule. Okay, between the legs and the teeth. Yan, itong vestibule ng oral cavity proper vestibule, actually, so, the unit divided into spaces. So, yung space ng ipen, that's the space. And the digest is the diastema, the physiologic gap. So, ito yung kita sa space, kaya nila siya dilano, or yung dilano sa space, space for the diastema, or the physiologic gap. Now, for the legs and check, okay, so here's the legs divided into upper lip, upper lip, and then lower lip. As yung muscle dyan sa galaw, it's actually the upper lip, okay? So, the limit at the lip commissure, and upper lip is more movable than the lower lip. That's the reason why we can change the check out. Yung natin ginagawa ng medication, especially from oral meds, ng tablet nilalagay. Kung kailangan ng tablet dito, kaya tablet na liquid divided siya. So, check natin ko sa side, yan, so, check natin. Now, the soft palate, kung yung meron butok, remember, yung soft palate is the soft palate, kaya hard palate, soft palate, meron siyang butok, yung incisive bone, the maxillary bone, the bone. Yung kaya siyang butok, yung soft palate. So, yung soft palate, and this structure, yung parang mga kapapanya, so, we call that palate rugate. So, palate rugate. So, natin siya into medial leafy. So, this is the it's not assisting medial leafy, parang natin ihas. And then this is soft palate. At the proximal end of the hard palate, incisive papilla. This is the incisive papilla. Okay, so, meron siyang so, what is incisive papilla for that? Now, for the teeth, okay, so meron tayong tawag na lower dental arcade. Yung mga ipin na connect sa mandible, so lower dental arcade. And the upper dental arcade, so makikita naman yung mga ipin na meron incisors sa maxilla at sa yung maxilla. So, nalasapit yung part ng teeth, we have the crown, and the root in between them is the neck. Okay, so in your, I think, histology, mas deep down, deeper yung topic na yung dentin, okay, dentin. So, ang dental part, yung most sensitive part ng teeth. Okay, so history as sharp fiber, yung most sensitive part ng ipin. Pag bulit na yung bukas na yung pasa yung wala na, mas gitna. So, naman pa, ang na, kasi exposed dental part, sharp fiber. So, yung the strongest thing, the teeth sa bone, yung composition niya, so that the area covers the crown. Yung nakikita natin sa crown, okay? Then, cement naman siya sa root sa baba, okay? So, they are embedded in the bone, normally sa maxilla, sa incisors, incistive bone, sa mandible. Now, the vestibular surfaces ng teeth, nasa vestibular siya. So, vestibular surface, ito yung diba niya, yung dilano sa kanya. Yan. So, this is the vestibular surface. Yung okay naman, ang vestibular surface ng teeth yan. Yan, lingual surface naman, ito yung kapag yung dilano sa lingual surface ng teeth yan. Then, contact surface naman, these are surfaces in between teeth. Yan, so contact surface. So, yung mga part yan, diba? So, contact surface. And then, yan, yung contact surface. Now, for the mesh surface, ito yung parang sa gitna. Part ng contact surface, the mesh surface. And then, yung distal surface, okay naman siya sa medial side. Mesh and distal surface. Now, for occlusal surface, ito naman yung kung saan yung upper dental arcade, lower dental arcade. So, yung upper and lower dental arcade here. So, ito yung occlusal surface yan. Especially yung this is very important. Kasi yung ng course ng lumen. Kasi yung pagbubuhat ng teeth, yung lateral area. So, yung occlusal surface. So, okay. So, yung siya ng now, for the classification teeth natin, especially yung mga alveoli, which means may two sets of division. Meron tayong temporary, meron tayong permanent teeth. Tawag natin ay phylon, two sets of division. Ang ibig natin classify as heterodon kasi heterodon division. Kasi ano, meron tayong incisors, here meron tayong canines, then we have the premolar and the molar. Heterodon tawag nila. Kapag ibig natin sa bayan, tawag nila homodont. Okay, homodont division. Pag heterodon, ibig natin ito. So, I hope you're able to classify the heterodon at homodont. So, that's important because yung heterodon, we need to enter the formula. Ako naman yung memorize namin sa mga ganyan. Memorize numbers, mga numbers na bukas natin. Hindi memorize before. Hindi memorize before. Kasi pamagandang formula ito. Yan, so, ano siya memorize? So, ganyan, may tulad yan. As order natin, incisor, canine, premolar, molar, kung ano yung susunod yan. Tapos, sa temporary, laging 0 molar. Walang temporary molar. Yes, total ngayon. So, yan. So, total, 28 sa dogs. Tapos, permanent naman, pipiliin tatlo yung as yung baba. 1, 1, isa sa baba, isa sa baba. Premolar, 4, 4, 2, 42. Ako dito nun, 6 yung memorize. Kasi yung mali, kasi yung marami, kasi yung konti. So, yun ang memorize. Kaya focus sa memorize ko. Sino kayo memorize ko? Alam ko, na konti po siya. Konti niya. Sino kayo baboy? 44 niya. So, yun yung ano. Galing. Pero, ano, may ako hindi konti. Pero, kaya ako memorize na yun. October, October. Yung plenty of time para aral. Sige, yun ako. Ako yung plenty of time. Yun yung nasusuka sa akin. Kasi, abi ako nun, ano, ako nililiwan. Kasi, ano, may ako nun. Pero, memorize na pressure ko kasi. Ano, yun yung parang classics mo ito. Bilang ng art. Kaya kasi yung study. Kaya ang bongga. So, yun. Parang aral. Tulad ng discipline sa. So, first time, taker, maximize your engineering pag-ibig niyan. Kung madalong kaya sige lang, ayaw ko sa susunod. Okay, so, repeat tayo ng makasa. Kasi, mas mabilis pa ng tanong nyo. Kasi, ano, parang, hindi ko lahat. Yan. So, kayo mga mali yung on follow. Okay. Ini bisa yan. Now, ang kaya yan. Medyo model yung nasa ito. So, ang nakaya yan. So, ang sa meaty muscle, meron siyang tayo. Tapos yung muscle ng so, meron siyang mga part apex, so this is point 1, meron siyang body, and yung root of the so bigyan ng organs niya yung mga chapter okay, yung apex. Ano na siya, yung bigyan ng pagtutulong organ medication. So, if I come to why, it's not diagram ng so, inbox, for the friend yung bigyan naman hindi masyadong malaki. So, the friend yan. And if you recall, meron Lysa, this is rod-like structure, so Lysa, SNDZ, Lysa, rod-like structure, the ventral side of the tongue. Now, inbox, very distinct, medial roof, yung as yung meron, very meron, kung ano yung so, ang so this is yung mga play, yung mga play, yung mga play, yung mga call this mga walang expanse, for example, so, free form yung most common present. So, free form play, makikita mo siya sa rostral tutor, yung rostral tutor yan. Free form play, yung play sa ano. Quality play, bigger than frequent, actually, some textbooks say quality play are qualified free form play. So, it's very evident yung gumina yung susunod nila. So, bakit yung so free form play. Yan. Yung marginal play here is one. This is temporary. Meron siya sa yung box sa gilid. So, sa gilid siya, tapos ay hindi na yung gatas sa sila ng milk okay, ulit so, temporary yung mawala siya kapag naging solid na ng dog. Tapos story. Ay, may full form play. So, mushroom, mushroom. So, full form play. Foliate, mga dahon, foliate, and foliate largest and most least sorry. Yung mushroom yan, mga play. Mga sabihin ng yung mga is yung mga play. So, yan. Play circumvallate equal so, yung mga play ng dila yan. For the pharynx, okay. Pharynx is a common conflict for food and air. So, natin yung so, for fermentation process. Meron sa dito. Yung mga common element. So, pharynx here. So, this is pharynx. So, this is pharynx. Okay. So, sa here yan, yan. Yan, pharynx. Balik natin sa pharynx. So, pharynx. Ito po si pharynx. Si pharynx. Kasi si pharynx siya yung sa boundary ng mga pharynx. Ito si pharynx for gas or pharynx for food and living pharynx. So, this is pharynx. The dorsal to the soft valley, soft valley. And then from the soft valley, all the fabrics. Nasa ilalim ng fabrics. Okay, fabrics. And then and also have booking with the fabrics. Kung meron kasi dyan, diba? So, the or the fabrics. I think ito, form recess, and yung okay, dito na lang yung buko, ang talon ng buko. Okay, so if you're practicing already, diba? Sa likod yung buko, that's the form recess. So, kasi yung blocks sa kaya, yung signature, ano yung openings? Ano yung openings? Sa forces, opening na out. Okay, sa forces. Sean wa, okay, or opening, Sean Sean. Kung ito yung naris, sa Spanish, may opening sa forces. Kung ito, pala naris, yung pala naris, yung naris, may naris ako na ay, pala naris pala okay, ano. The opening at the audio ito. So may opening split line, yung mga kasi ito. Because may nose mo, parang sisika. May mga pressure dito sa tingin mo. If opening, sa opening ito, kung ano yan. So yan. Then dito sa opening also, opening kaya is the naris na opening kaya. Then dito sa opening sa focus. Okay, click lang din na, kasi nakaka crossover, may pagkakulog ni naris ni naris sa logic. Kasi nasa five sa borsa sa siya. Dahil yung hangin dito, naris dito. Tapos kasi kaya, dito, di ba? So mga siya pa. Yung pagkain dito, yung focus, yung dito, tapos siya. Tapos dito, kasi focus dito. Pagkain cross siya. Kaya iwasan natin yung mga tapos sa dito. Kaya yung buka siya or dito. Kasi kung kaya dito sa kaya, yung tuno mo ka ang release siya. So, cross region na. Now, isa focus ang ano dito, ay to transfer class abdominal siya. Right, so class. And this focus is actually initially, I think kaya nasa so cross siya kaya yung sa left side. Okay, so this two parang finger, the finger finger, and the part finger. This finger, actually